Cannabis-related emergency room visits have increased by 53% in Maryland from 2022 to 2023. Now, that's according to data from the health department. Some of those visits are related to a severe condition that develops after using high concentrations of cannabinoids over a long period of time. And this illness is posing potential health risks about the quickly changing drug.
So, for those of you who don't know, I quit smoking weed this year. It's been roughly 21 days since I've been off the Zaza, and I just want to enlighten you all as to why I am no longer a chiefer of the reefer.
A rare illness is gaining traction on social media.
Crazy stomach pains and migraines and nausea and diarrhea.
With users describing a litany of symptoms linked to cannabis use.
This first started happening to me last year, every 4 to 6 months or so. And I would spend a day or two going through a cycle of vomit, shower, sleep, vomit, shower, sleep.
Through this video call, Ron Buckley can still remember similar symptoms from what he initially believed was a mystery illness.
I couldn't get out of bed. I was vomiting uncontrollably. The only thing that would make me better was to sit in the shower with hot heat hitting me.
Down 30 pounds in 2 weeks, followed by repeated medical exams, but still no diagnosis.
Finally, when I went to the last ER, the nurse that was helping me in the ER looked at my chart and saw that my THC levels were ridiculously high. It was like, you have CHS.
Cannabinoid hyperemesis syndrome affects people that use high doses of marijuana frequently, first medically documented back in 2004.
As soon as she told me that, I was kind of like, I think this might be it. So me and my wife just looked it up right then. Apparently it's a lot more frequently happening.
Buckley sharing he used marijuana for 20 years and never experienced anything like this.
Obviously, I knew there was something wrong with me because I couldn't keep anything down. Literally, the wheelchair they put me in, I was falling out of. I couldn't even stay in the wheelchair.
It's really interesting how the smell of marijuana is starting to permeate both the patient rooms, the hallways, and our waiting room. And it's a very common occurrence to walk out and just be inundated with the smell.
Emergency physician at MedStar, Dr. Chris Wilbert, says CHS is not as uncommon as most people think.
It can also be challenging for patients to be accepting that that's the cause of their symptom because they think, hey, this is marijuana, this is something that should be helping me, right? You can go and get a medical marijuana card and it's supposed to help me, but now paradoxically, it's causing me to vomit.
Because of that misperception and the lack of tests for diagnosis, Dr. Wilbert says CHS is often overlooked or misdiagnosed.
So this last time when it started happening, started feeling lightheaded, kind of like cold sweats almost. And then immediately my stomach just turns upside down.
Emergency room doctors say they are seeing an uptick in cases.
Anecdotally, it does feel like we are seeing a lot more patients coming in with CHS, with vomiting, with abdominal pain.
The Maryland Department of Health launched this public health data dashboard as a new tool to track the effects of cannabis use. It shows data on ER visits, calls to poison control, youth and adult use, plus various cannabis trends. The dashboard reveals that Maryland has seen more than 800 ER visits a month involving cannabis.
Be wary of what you're using, The marijuana today is completely different from what it was 15, 20 years ago.
Dr. Wilbert says taking hot showers and staying hydrated can alleviate some of the symptoms.
Is there like a one-dose treatment to treat CHS?
Unfortunately, with cannabinoid hyperemesis syndrome, the only way to prevent it from happening is to stop marijuana use.
Buckley opted to stop.
For me, I probably won't smoke again because once you get CHS, there is a chance that it can trigger again. So there's a possibility I could smoke once and I could be down again.
It's cyclical. It tends to come on for like a couple of days and then it'll go away and people will be fine. They'll either resume or stop using marijuana and then they'll be back in the emergency room.
And look, to get an idea of how widespread this is, a 2022 National Drug Use Survey found that more than 4.5 million 18 to 25-year-olds use marijuana daily or near daily, with 81% meeting the criteria of cannabis use disorder, which is the type of disorder that invites CHS.